Okay.
Okay.
So we will now learn how to do rigid taping for wrist injuries or rigid taping of the wrist joint. So if you look at the skeletal anatomy of the wrist joint, it is quite a complicated looking joint. It has a radius and ulna on the top as long bones. It has 8 carpal bones, the trapezium, the trapezoid, the capitate, the hamate, the scaphoid, the lunate, the pisiform, and the triquetrum. These are the 8 carpal bones, and then you have the metacarpals that articulate with the carpal bones. So wrist is an interplay of the inferior radioulnar joint or the radiocarpal joint, as well as the joint between the metacarpals and the carpals. Alright, so if you look at the other side of the wrist, that's how it looks like. So it's quite a interplay of multiple bones, and because we have hand on the top, therefore there has to be a lot of control. So if you look at the muscular aspect of the wrist joint, you will see multiple tendons pass through the wrist on the extensor aspect. Alright, so we have the extensor carpi ulnaris, extensor digiti minimi, extensor digitorum, extensor indicis, abductor pollicis longus and brevis. Then you move on the inner side or the anterior aspect of the wrist. You will see again a bunch of muscles, this time quite bulky. You've got the flexor carpi radialis, flexor carpi longus, flexor carpi ulnaris, and we also have the palmaris longus. This all travels through the wrist joint, because eventually these tendons have to go to the fingers, so that our fingers are able to give us precise control and a range of movements that we extract out of our fingers. Alright, and wrist being the last joint in the hand, it kind of enables us to provide a lot of control and precision in our movements. So with that, let's now come back to our athlete. So that's your wrist joint. This is the neutral position. This movement is called as plantar flexion, palmar flexion, because this is the palm. So this is palmar flexion, and this is dorsiflexion, also called as extension. All right, and most injuries that happen are the hyperextension injuries. Okay, these are the most common injuries. So what we will learn now is to do rigid taping for a possible hyperextension injury. Okay. So this is nice and clean, not much hair, no wounds, no blisters, not much oil on the skin. So this is a perfect situation where we can apply the tape directly over the skin. Okay. So the way we will start doing it is we will strip out small little anchors. It is good that you do it slightly obliquely, because it kind of fits onto the skin. That's a bit too high. I don't want to go that high. I don't want to waste the tape. Somewhere around here is much better. So slightly oblique. You see there's a slight obliqueness in the slip. It's not exactly straight. You see this is going up, right? So that's slightly oblique because it nicely conforms to the contour of the make of the forearm. Okay. Then again slightly oblique, the second one, kind of covering about 50% of the layer underneath. So slowly we are coming down towards the wrist joint from the lower part of the forearm. Try and erase these wrinkles as much as you can. Some of them will be in place, but ideally it should look nice and clean. So maybe just one more. Now I'm almost overriding on her wrist joint. So yeah, just kind of one more. Okay, so that is how you start your taping of the wrist joint. All right, turn over. Try and flatten out these wrinkles if you can. Even if you cannot, this is not going to rub against anything like in the ankle, but what's clean is also it looks good. So now what we're going to do, guys, is if you can come over here with me. Now I'm going to stretch out, maybe just turn around. I'm going to measure a little bit of her wrist size. Now I'm going to create a splint out of some layers of tape. So that's one, That's 2. That's 3. That's 4. Okay, so it's almost like a fan. And now what I'm going to do is, I'm going to apply this fan on the palmar side in this manner. Okay, so now you understand why the spread on the top was more than spread on the bottom, because I want this more grip and more adhesiveness. Yes, it's very important that the fingers are spread when we are taping the wrist joint. Okay, now because it is here, it's now very difficult for this to go up. You see, try dorsiflexing, you see I'm holding it. So this fan is almost like a splint. If this was a flexion injury, the fan would be on the top side. So yeah, very absolute common sense. Good job, guys. So now what I'm going to do is I'm going to secure the wrist similar to the way we secured the ankle joint. We spread out the fingers. Good job. Now I'm going to start from here. Okay, now there's a finger webbing here. You see this? We don't want to rub that. So I will kink this like that. Okay, and that part is free of the finger webbing. All right, now what we're going to do is going to create a figure of 8. Simple, just like the ankle joint, we create a figure of 8. Okay, remember this is a dorsiflexion injury, so just a bit of plantar flexion is where you want to keep the arm with the fingers spread out. Wonderful. Okay, maybe just one more figure of 8. What I can also do now, guys, why don't we do this? We extend this figure of 8 along with a layer on the wrist. So we start from here now, and then we create a figure of 8. Okay, we start slightly oblique because we need to go slightly in an oblique manner. So from here we move into, right, so we move into figure of 8 from there. And again, as passing through the web, I do slight kinking or reduction in that width so that the web is free, and slightly pushing into palmar flexion. We now finish it off with another layer here. All right, make sure that this is free. Bend this inwards and ask the athlete to do a fit of, yeah, nice and closing approximation of the thumb, and ensure that no rubbing is happening. Yep. All right, good. Try and flatten out these creases if you can. Okay, and then you want to put just one more supportive strip on the knee, and you are done with taping of the wrist joint. Okay, a good way again for checking this is you must always see this filling is happen instantly. So that means it's not too tight so as to be occluding the flow of blood. Okay, remember the hand should be remaining in shake hand position. That is the position in which you just retain that position. I'm taking my hand out, you retain. That's the position in which the hand should stay back. That's a neutral position. It's a very comfortable position of the wrist. All right. So this is to prevent. So she can easily do flexion now to a large extent. But when it comes to extension, you see it's quite restricted now. That is precisely what we want to achieve. All right. So good.